Welcome back to the BioHub. Today we're excited to host Dr. Christina Trojel-Hansen. Christina is a leading figure in biotech, having co-founded several innovative companies, including Tune Therapeutics, which specializes in gene regulation technology, Oscine Therapeutics, which is making significant advancements in CNS cell therapy, and Pretzel Therapeutics, focused on mitochondrial diseases. As an entrepreneur in residence at Arch Venture Partners, Christina has played a pivotal role in transforming early stage ideas into viable medical breakthrough. Christina's strategic insight has also been instrumental in securing major Series A investments for biotech innovators like Adcendo and Stipe Therapeutics. Her leadership and vision have earned her a place among the top 10 inspirational women in Nordic Life Science and the Endpoints 20 under 40, highlighting her as a future leader in biotech. Join us as we delve into the story of entrepreneurship, innovation, and leadership in the biotech landscape. Welcome to the show, Christina. How are you?
Thank you so much, Max. That was a great introduction. I'm very happy
Thank
to be
you.
here on the BioHub podcast and excited to delve into the discussion here.
Yeah, amazing. Amazing. Let's go straight into it. Let's start off by to share the story of what initially drew you into the field of biotech and venture creation, and who or what were the major influences of the start of your career.
Sure, yeah. So I would say, in my background is originally in nanoscience. I've been very curious about different disciplines of science, but eventually I found my love for biomedical science and moved into the field of epigenetics when I was in Denmark, where I'm originally from. And it was very, fascinating for me to really get into the understanding of the mechanisms that regulate cell fate. When is a cell healthy, when is it sick, etc. But I think more important, early on, it sort of became clear to me that we can use those insights, obviously, as people have done for years, to translate those discoveries into medicines that can actually circumvent or ameliorate disease or even aging processes, which I'm also focusing on at this time. Nonetheless, I continued my sort of scientific research. I built on top what is called an industrial PhD, which is a program that we have in Denmark. And it gives you an opportunity to work on a scientific project in collaboration with a biotech pharma. So you kind of like get the understanding for what is the additional aspects that it takes to transform academic research into medicines. And so that was really where I started to have my curiosity to make a difference in the bridge between academia and in translation of the science into medicine. So from bench to bedside, as we like to say, and sort of continued my journey in that area. Went to UC Berkeley and did my PhD project there with a professor in the area of immunogenic cell death. Again, really with a focus on identifying new targets we could utilize for treatments of cancer. So it's always been something that's really been on my mind. But as an academic or as a scientist, you're still missing the tools to really take it beyond that. So when I was in California, I could definitely see that there was a very, you can say, blossoming venture capital environment. And I got in touch with a company, actually it was a consulting company that had a foot into the nanoscience field, which was called Lux Research. And started working as an intern, sort of helping on evaluating startup companies for their intelligence platform, et cetera, et cetera. So that really sort of, I would say, guided me towards that I was probably more suited to be in the venture creation entrepreneur environment versus the academia environment. But it's not necessarily an easy step to always just jump into that right away. Nonetheless, I got the chance to do a postdoc in Paris, but I would say got a little tired after the time being in you could say, the animal facility and just doing lab culture work, which I actually share with many of my fellow entrepreneurs in the field. It's funny how we have sort of overlaps in some of those thought processes. But anyways. It was at a big cancer hospital, and again, going to work at the Gustave Roussy, one of the biggest cancer hospitals in Europe, and doing the science at the bench there sort of motivated you to really, okay, you really want to do a difference where you can translate the medicine. And I could see that I probably had the skill set that where I could talk the science, but I could probably also talk the business. So that was sort of at the point that I decided, okay, let me change pace here and get some experience from industry. And that was sort of where I started my industrial career. I started in a patent firm and moved on to Novozymes, where I worked in first in the licensing and patent department, and hence the business creation department. And that gave me a tool set that put me in a, you can say, position to actually join a venture firm, which became Novo Seeds. That's part of Novo Holdings, and
Okay.
and that was really a place where I felt, this is a perfect spot for me, being right in between academic research and translation and venture creation.
Amazing. Yeah, I always wonder that, like how you fall on that side. So it's
Yeah.
fascinating.
Yeah, and I would say, the at that time where I really got that interest, I think I was out of my postdoc probably in 2012, or it must be around that time. The ecosystem in general in Scandinavia was not as advanced as it is today in terms of junior roles in venture capital firms. So oftentimes it required a little bit more, you could say, a broader toolbox to really become part of that ecosystem. So you have to spend some time on developing your tool sets, like you take educations to position yourself to be an attractive candidate for a specific job or something like that. So that was sort of the mindset, and I learned a lot along the way, and I actually felt that I was much better position to work in a venture capital fund with that additional, you can say, years of experience in jobs in industry.
Yeah, amazing. And then, like, you founded companies such as Tune, Oscine, and Pretzel. What was one of the first major hurdles you faced when starting a biotech, and how did you overcome it?
Yeah, so certainly. So in my time at Novo Seeds, which was a fantastic time, I loved my job there, being especially working close with my close mentor, Stefan Kriskau, that now is running a company called IA Ventures, a new venture capital fund in
Okay.
Europe. I had the fantastic opportunity to use a grant program that was sort of at that time really administered by the Novo Nordic Foundation, and it was pre-seed grants. So basically, we could go out, identify new science, or work with incoming scientists that had applied for the grants, and it gave us the opportunity to plant small seeds before and make them ready for, you can say, either a seed financing or Series A financing.
Okay.
And you would work really closely with the professors. So here, one of the examples was that I reached out with my sort of curiosity and interest in the CNS field. So I reached out to Dr. Stephen Goldman out of Rochester Medical Center, and awarded him a grant. I worked very closely with him, and we were sort of getting to the point where we were ready to put a financing around this company, Oscine Therapeutics. Stephen encouraged me to jump on the other side, so to take the CEO role for the company.
Oh wow.
And that was, I would say, kind of scary, but also a very important change in my career, because suddenly I was not on the venture side. I was on my own on the other side.
Yeah,
Of
yeah.
course, I had you can say, some understanding on being, working in the venture field, and having been a sport observer, what it would take. But when you're on the other side doing it yourself, it's certainly, you can say, a different experience. And I also learned that it's not that easy to raise capital, and especially in the cell and gene therapy field, it was very, very tricky. It was back in 2017, 18. I would say that the cell and gene therapy was sort of getting more traction. But if you look to America, you could see that there was big rounds. So I took I took the chance to move or to start to look for venture capital funding in 18, and at the end of 2018, I was fortunate by being a very dedicated young lady to meet with Bob Nielsen. So in
Well,
that sense, I think there was an element of being, you can say, hungry and prepared, but also you can say not afraid of knocking doors in, being persistent. And I think that moment there was a part of a return of on luck,
yeah.
but it definitely came with the dedication and knock as many doors in. So that created a completely different change, because suddenly we had the door open to one of the biggest venture firms in Europe. He had interest in building a big company after his, you can say, sale of Juno Therapeutics to Celgene
Oh
at
yeah.
that time, and had interest in moving into the cell and regenerative medicine play, which became Sana Biotechnology, which is one of the biggest regenerative medicine cell therapy companies out there. So we ended up making an option, a collaboration agreement with Sana Biotechnology, and then subsequent we got acquired in 2020. So I think that moment from stepping out, taking the CEO role, being persistent and somewhat naive, I think, and hungry at the same time. Of course, being very much prepared, and then
Yeah.
getting to the right investors. There's a lot of different pieces that sort of has to come together, and then it was just like, now it's operational time, and get the process going towards achieving the milestones for the you can say agreement that we had with Sana Biotechnology.
Would you take that sort of role again? Is that on the horizon, or
Excuse, what did you say?
I say, would you take that sort of role again, or is that on the horizon, or
So, I mean, all of the companies has sort of different, you can say, moments where it comes into fruition that the company is going to be successful. So, but that one
Mhm.
was certainly the biggest, you can say, the biggest moment in that company's history, and it was my first company too. So I really learned a lot from the process and what it takes.
I can imagine. Imagine. And just describe, during the early stages of a startup, what's critical to its success.
I think there's many aspects to it. I would say so. Of course, it's critical to, you can say, work with professors or academics that has high quality science. So I think,
Okay.
certainly think that the quality and the rigor of the, you can say, the academics is critical to its success. The other thing is to get the right investors around you, so that you really surround yourself with people that is willing to help, not only with money, but also, you can say, with guidance, networks, etc. And then the third, of course, talent is always the critical enabler. That you have somebody or a team that's really willing to, to work hard, to lift as a whole, and not afraid of taking different responsibilities. Because when you're in a startup company, you wear a lot of different hats, and it's not like
Yeah,
somebody's
yeah.
to tell you necessarily, now you have to do this and this and this today. So you have to be self-driven and all these kinds of stuff. So I think these three things are extremely critical to build a successful company, and especially that early, like, teeny tiny team of maybe the first 3-5 persons is super important, because that's where the big entropy is really
Yeah,
really
yeah.
in play. And I will give big credit to, for example, when we put Tune Therapeutics together. So Tune Therapeutics came from the idea of using these epigenome editors to manipulate cell fate. And of course, that came sort of, you can say, based on zinc finger, then the CRISPR revolution, and all these, exciting developments in that CRISPR field. And so for Tune, Charlie Gersbach had been, is in my opinion, really the leader in this field. And he's a co-founder from Duke of that company. And he had a handful, four in particular, really ambitious and fantastic PhD postdocs from his lab. And they actually they came over to Tune when there was no people. It was me, Emerson Collective, and then they actually decided we got Akira in from Seattle, and they jumped right over. Of course, they were afraid, what's going to happen, and then COVID hit, so we had to do a lot of the company sort of crazy and
Wow.
get all together on Zoom, but without their dedication, you can say, and really commitment to the company, and it wouldn't have been gotten up for a start. And they stood with the headwinds of all of these macro environment circumstances.
Yeah, you know what? It's strange, isn't it? Like, I often ask, these people who have been in industry for 40 plus years, and coming towards the end, and I say, look, what would you change throughout your career, or what are potential regrets? And the most common answer is, oh, I wish I'd taken more risks. So I think
Yeah,
it's strange. Like, family obviously gets in the way of taking risks. So you either take those risks at the very start of your career or the very end.
yeah.
It doesn't often happen in that middle. So I think for these postdocs coming on and doing that, I think, yeah, brilliant. I think, and looking in hindsight, they definitely made the right choice.
Yeah, no, it's certainly true. I think when you have a family, there's more to risk, of course. But at the end of the day, if you come into a company that has some funding, where the CEO is running a huge risk, you can say in that sense for being
Yeah,
being kind of responsible, unless you can say you're on the same level as being co-founders in the company. And if there is some money, you're still going to get a salary. Okay, if the money runs out, even in pharma you can be laid off. Then the worst thing that can happen is that now you have gotten some actually attractive experience of being
yeah,
early stage in a startup company, and it's not going to position you worse than where you were before in terms of applying for jobs, if you feel like you want a more secure job in a pharma company versus a biotech, etc. So I think the risk taking part, as I said, also from the encouragement from Dr. Stephen Goldman to me taking the CEO role, it is really a game changing thing, and I hope that more people is seeing that it's not the end of the world if it doesn't work out.
yeah. And you know what? Like, it's all in your mindset as well. Quite often in biotech, it's things that you just cannot control. If the science works, it's going to work. If the science unfortunately doesn't work, then there's really not much you can do about it, and it's nothing against you and
Yeah.
you've done in terms of your job. It's just unfortunate. Yeah,
Yeah, exactly. I mean, I've had the projects also failing and being without a job, in between companies and in between venture funding. So it's you have to live with that opportunity, and then maybe you can do some consulting. So I've never had the interest really to go fully back into venture capital or into a big pharma company, because now I like to be in this sort of, you could say, startup
nice.
environment. So that's it. But I think the risk taking is good, and advice to people: if you do feel like going into an entrepreneurial startup sort of direction, that's the place where you learn the most. I think going into large pharma, large biotech, that's much more, you can say, rigid in the silos that's existing, doesn't give
Yeah,
you the exact mindset and tool set to become, you can say, a good entrepreneur.
yeah, 100%. And then, like, I suppose this follows on really nicely. Reflecting on your own journey, what specific experiences or skills do you think were most crucial before starting your first biotech venture? I, I don't know if from your standpoint you felt like you hadn't had them or you felt like you needed more, but yeah, I suppose what's the case?
I think that certainly it was beneficial for me to have had the experience for, you can say, the venture capital years. No doubt about it. It made my journey a little easier because I knew more about what the investors would think when I would be standing on the other side. So of course, I mean, you cannot neglect that experience. But then I think, again, coming back to what we discussed. The risk taking is really, really a critical part, that you're hungry, you're willing to take a risk, and you're not afraid to ask for help. And I think these things are really critical, because you would never know everything when you when you start a company. I kind of knew nothing. I would say maybe a little bit of here and there, but it was all like, then you align yourself, you surround yourself with the expertise that you need in different areas, and then you'll figure it out. Ask, better ask twice than not ask at all.
Yeah, 100%.
Yeah.
I suppose my next question was, what advice would you give to someone looking to gain the right experience? And I suppose it's that, surround yourself with the right people,
Yeah.
ask questions, don't be afraid of that. And anything else, or
Yeah, and I would say that these are two things, and always be very well prepared. Try to prepare yourself as good as you can. I mean, in terms of do your homework, read on the science, try to understand as much as you can, so it's you actually you get to ask some the relevant questions, and not the high level questions. So I think you can, there's a lot you can do in that, so you come across also more, I would say, committed to the project. So that's basically an important thing too.
yeah. And looking at, I suppose you might be thinking this in terms of your next opportunities, but where do you see the greatest opportunities for innovation in biotech over the next decade?
Oh, I think there are certainly, there's certainly different areas, and everybody is of course interested in talking about AI, which I think has a lot of potential, and I think the ability of also understanding greater detail protein structures, interactions amongst proteins, so the alpha fold and all these kinds of mechanisms, going to be helpful in terms of drugging new targets, etc.
Mm-hmm.
One of the things that I'm focused on at this time is understanding how can we sort of block the aging process or restore the youthfulness of the cells. So one of the companies I'm a founder of at this point is called CNS2, and central nervous system too. And basically some of the stuff that we are really focused on is how can we rejuvenate the brain cells in aging.
Oh wow.
And of course it's a very popular field, and I think there's a lot of hot air. So you always have to be a little bit careful when you talk about some of these rejuvenation plays out there. But I think if you're very careful and do the science right, there is a great opportunity in potentially preventing and circumventing a lot of diseases that's basically caused by aging. So I think that is a very exciting field. And then of course I would say what has been going on with the development of the tool sets really allow you to use the tool sets now to apply them to biology. So I think that's a really important thing, and I'm excited to see where the field goes, and let's get out of the hot air and then get to the real
Yeah, yeah.
hard core
I
science and
think
biology understanding.
I think you said something really interesting then as well, like in terms of the hot air. Um, is that something you have to be really careful of as an investor on the other side? Is it like good salesmen, but maybe they've not got quite as good science kind of thing?
Yeah, that there has certainly. I think there's certainly an element to that. I think in these fields that gets a lot of attraction. It can even in nanoscience. I remember back in the days, now we're talking about rejuvenation, anti-aging, and certainly there is a lot of hot air. So I think as the investors, and especially with sort of, you can say, the change of the market situation, the interest rates, etc., there's certainly a little bit more carefulness in terms of who you're investing into, and there has to be more sort of thorough diligence on what is the science and the potential, and also the ability to translate that sort of academic idea into real medicines, and does it make sense at all. So I think that is something that people has to be able to navigate that landscape.
Yeah. Is there an element of like investors looking at you, for example, are going, oh well, Christina's done it with Pretzel, she's done it with I've seen, so this is most likely to come good as well, rather than specifically looking at the science.
Yeah, certainly. I think when you so we don't know if these companies are going to work but they are on traction, to actually get to patients. I think maybe in 24 and 25. So it's I still bet on the science, and I did my homework and diligence when starting those companies. I spent quite a lot of
Yeah.
time on it. And so I think there is a lot of smart people that has now also been looking into the companies, and they see the same as I did in the beginning. So obviously that sort of gives me more, you can say, confidence in, and probably also investors more confidence in the projects that I am identifying and working on.
Yeah.
I carefully select, but we never know if, if it's gonna be a drug at the end. But I do what I can, and I follow my same sort of rigor when evaluating the science and the people that I work with.
Yeah. Nice. Yeah. Yeah. Talking of you, you've been recognised as a top inspirational woman in Nordic Life Science and among the 20 under 40 by Endpoints. Uh, How does like awards like that make you feel, and I suppose how do they potentially impact your career and future career?
I mean, at the end of the day, it's an extremely nice recognition to get it. So of course, somebody is nominating to become part of those lists, and certainly it boosts your self confidence. So I think that it's a momentarily boost that
Yeah.
comes. It's not like it's changed. Wow, now I have that stamp on my shoulder, so it's just easy for me to go and raise venture funding, for example. But certainly does give me some credibility. It does give you some visibility. So I appreciate those lists, and I think when I look at them, I'm extremely honored to be part of that group of people that's selected on those lists for because there are a lot of amazing individuals out there that really work hard to change the world and the biomedicine biotech sphere. So from that perspective, it gives some self confidence, but it hasn't really impacted my career, I would say, in the bigger scheme.
Yeah. How do those awards like come about? Is it kind of out of the blue? Someone contacts you and says you've been nominated for this, or do you expect do you expect it's coming?
No, I would say even at the 10 most influential women, I kind of figured it out because there was a post on LinkedIn, so
Oh, really?
I didn't even know about it. And I would say on the endpoints, I got a call and an email from a representative from endpoints that said that this was the
Nice.
case. So it was, you can say, a very happy moment to receive such a call. So still very proud of it, obviously. Yeah.
Yeah. I mean, not like I'm expecting one, but I just wondered.
Yeah, yeah. I mean, I think the process is like with any other thing. Even you could say for the Nobel is that you have some people that actually take the time to go and submit the candidate, and maybe the argument for why that candidate should
Okay.
be on that list. So of course it requires that you have some supporters in the field that think you are fit for for joining that group of people.
Yeah. I mean, yeah. Congratulations. It's amazing. It really is. Um, yeah. I think one thing we wanted to touch on was especially from a startup standpoint, and also an inspiring woman in biotech. How have you approached building diverse teams in your ventures, and how do you believe do you believe there's still a diversity issue in the industry?
So what is your sort of definition of diverse teams in that setting?
I suppose we're talking about diversity in terms of ethnicity, in terms of gender, in terms of
Yeah,
every sense, but in terms of
on the broad
the
scale.
yeah, in terms of the team in these biotechs, not necessarily
Yeah.
like patients or other aspects in the industry.
Yeah, sure. I would say typically, as you can see, my role is really, you can say, on the earlier part of the company's lifetime, and it's not like I've been running major companies where you consider it even, you can say, further in terms of diversity as a core, especially when you're a public company. So of course, it's something that's on my mind. I think about it when I put, for example, my scientific advisory board. For example, for CNS2, I have two really strong women, Beverly Davidson and
Okay.
Paula Lotta, in the advisory board. And of course, I'm a female, and my scientific founder of the company, Mike Nedergaard, is a woman. So I do have some, especially on the, you can see, female male gender. I'd like to encourage females to step up in the role, and come more out into the biotech world. But at the end of the day, I would say my strongest focus is really on, you can say, the qualifications that you have, and the drive, and the commitment to the project. Because especially early start, I can't select on anything else. I just have to have the best people that's willing to do
Yeah.
the work, that's committed, that has the drive, and that's what really matters for me at those early stages.
No, I agree. It's still got to be the best person for the job, and that's regardless of anything else. I mean, the changes I'm seeing in the industry is people are just becoming so much more aware of it. So,
Yeah,
for example, when I do a search now, if I'm retained in the role, there's a service we offer where we basically tell them, we give stats and percentages on ethnicity, on gender,
yeah,
of all the people that we've put forward and all the people that we have approached for the role, and
yeah.
people are much more interested in that part of the service than they ever have before. So I think things are changing, and it's just awareness more than anything.
Yes.
I mean, for you, do you feel any impact being a woman in the industry, or not really?
Um, well, it can both be good and bad, I would say. So in the sense that there are incentives to, you can say, promote females, to promote women in the biotech industry. So I appreciate that, even considering boards, as I mentioned before, that now you want to see like more 50-50 percent representation in the boards, and I'm happy that these, you can say, things exist. But I think deep down, I still think, you're going to be the best for whatever role that you're going to take. And though many years, and I think particularly to arriving at where I am now, I feel I had to work maybe twice as much as my
Really?
male counterparts, and be even better prepared for, stepping into any discussion and stuff like that. So of course I have certainly lived through that, and probably still do it sometimes with it, but I think it's still certainly getting better.
Yeah. I mean, I just want to talk about your mindset as well, because I think it's absolutely astounding, the hungriness that you've got and the resilience that you've shown. I mean, what really drives you through all of this, through founding multiple companies, through building, and yeah, what drives you?
I think I'm just excited. I'm excited. I'm very curious about the science, and I'm very, very, you say, committed to try to do a difference. So, and now it becomes easier when you have done it a couple of times. It's very
Yeah,
easy to see how can you actually help the academics, because at the end of the day, if you get an NIH grant or a small grant, it's not going to move the needle for them to actually translate that in potential game changing discovery into a medicine. So I think it's that it gives me a lot of joy to work with the scientists and actually feel that I can, via having, you can say, a leg, a network in the venture community, can actually enable and accelerate the translation of those discoveries. So it's a fantastic job that I have in that sense. And I think, yeah, generally it's just it's really the curiosity and excitement for being able to leverage these tools and these connections. It gives me a lot of joy.
that's amazing. Yeah, you can really feel it as well. I think that's the most impressive thing, definitely. But look, yeah, that's all we had time for, and it's been an absolute pleasure, Christina.
Likewise.
And look, please like, subscribe to the BioHub. There's more episodes on the way. But absolute pleasure, Christina, and speak soon.
Thank you. Bye.